we're just going to highlight where there's anything severe. So you're going to lead me. You tell me what to do. So I got you started by highlighting the severe level of toxicity.
And then also highlight the moderately stressed, the adrenal function moderately stressed.
Perfect.
And the severe potential or presence of autoimmune suspicion.
Okay, good.
Then the head, it says the disorder remained high, and you said that should be low just a little bit ago.
Yeah, they should all be low. So that will make what's going on in the head area a little bit more important.
And then the next two are minimal, but severe temporomandibular joint, which I would have expected due to her severe trauma to that area.
Okay.
Severe hypothyroid.
The pink, yeah, because that we don't know how severe that is, so we'll just keep that highlighted.
And now all those disorders increased where they should have decreased, correct?
Yeah, they did. So we can go, I can show you where we can go to the graph at the end and look to see how high they are. But if the disorder remained high, that's the most severe rating. So.
Okay, and then a moderate pattern for uterine hypofunction.
Okay.
And a moderate indication for kidney toxicity.
Okay.
A moderate degree of stress vertebral column. The cubical thought that disorder remained high, but the region is normal. So I wasn't sure what that meant.
Yeah, so we'll look at the temperatures there, and we'll look at the behavior of the temperatures as well, if there's blocked regulation.
And then a dental focus, it says hidden focal infection, severe temporomandibular joint, or neck disorder pattern identified. Okay. And again, the breast remained high, and severe side-to-side. That I thought might be because I could not get a reading on the the nipple. So, but I don't know. So obviously we need to check it out.
Okay. So you can see some of these priorities coming in here: the thyroid, the breast, the toxicity index, the TMJ, the autoimmune and adrenal. They're all here.
Right. They all seem to follow what the above said.
Yeah. Okay, what is the most outstanding thing that you see in this?
All of her head is practically in inflammation, is paradoxic.
Right, but it's, yeah.
Wait, that's right. Oh, question. The maxillary is opposite and the thyroid is opposite. So if the maxillary is opposite, should we look at the chart for the body, and for the thyroid, look at the chart for the head?
No. This chart, that's a really, really good question. This chart here pertains to the head area. Okay, so if something is paradox blue, it's talking about every single point here, even the maxillaries. So if the maxillary is blue, you know that there's inflammation because it's supposed to be decreasing in temperature, and blue is paradox. So for instance, this red, what is this right maxillary sinus doing here?
Hyper.
It's hyper, so is it warming or cooling?
Warming, or what's the opposite?
So
it would be, because normally the head warms, so this would be cooling?
Okay, so that's right. So the maxillary is opposite, so the maxillary's normal behavior is to cool. So the hypernormal behavior is a hypercooling. So even though it's red and it looks like it would be inflammation, it's not. It's hypercooling, and it's toxic. It's showing a hypertoxic reaction. And then this paradox regulation that we see in almost all the head points is showing that instead of warming temperatures, the head temperatures are cooling. And it's actually this whole body, this whole picture is hypercooling, which is, can be severe adrenal stress, and sometimes, I'm not sure of the algorithm, but it also an autoimmune can be autoimmune. So the thyroid is behaving exactly like the head area. It's a really good example. Let me shrink it down, out a little bit. The thyroid is paradox, so instead of warming, which is normal, it's cooling. And it's supposed to be behaving like the head. Well, it happens to be behaving exactly like all the head points because they're paradox as well. They just have a different color coding. So the whole body is showing a hypercooling or a cooling. The head is showing cooling. The body is showing hypercooling. So that's going to be a very interesting graph at the end, because the hypercooling is just systemic toxicity. That's why that toxicity was severe in here, severe level of toxicity. And the autoimmune, I think, has to do with the toxicity and the thyroid.
Okay.
Okay, so now the dental areas.
Okay, so the arrow to the right, there's more, she did have more trauma on the right
Okay.
than the left, even though it looks like there's just one tooth.
Yeah.
It's all her, it was the lower part of her jaw. I mean, the upper obviously was affected some, but it was primarily the lower part of her jaw that she had the trauma. Well, I guess it would, she was stressing the lower part. But since it's showing temporomandibular, it almost has to be the whole thing.
For stressing the lower part of the jaw, you're saying?
Yeah, she was stressing that was the part that was, I don't know if it was crushed or just in a lot of pieces. She was young. She was in the hospital, I think, 6 months because of this accident. She was in a coma for a while, I believe.
Wow. Well, the regulation of her teeth overall is fantastic.
I know. That's what is kind of surprising considering, but she said it was to her jaw. She didn't say anything about her teeth, so maybe that's why. And she was young. That could be another.
And did she have any root canals or anything that you're suspicious about or you think might need to be checked?
I didn't think to ask her that.
All right. Well, the teeth didn't really, I mean, it came up in the bioregulation results, but it didn't really come up as a priority. Am I right here? Yeah. So I don't think it would be worth being a priority. I think this looks great. So
compared to all
I wouldn't camp there. Yeah, I wouldn't camp there very long. And the breasts, what do you think about this breast picture?
Well, it's again showing let's see. She's only got 2.5 criteria, so really the one breast is warmer than the other, according to the arrow.
Yeah.
And I don't know if some of that could have been because it was the right nipple that we had so much trouble with, if that had anything to do with it. But the fact that there's only 2.5 criteria.
Well, there's 2 out of 12. 2 out of 12 criteria. There's 12 criteria in this table, and only 2 of them are out of range.
Okay.
Yeah. So, yeah, I mean, this is a really great breast analysis so far. As far as the regulation, we're just seeing the left breast is warmer. But as far as, the breasts are behaving like the rest of the body. if not a little better, with this normal regulation on the left side. So if anything, go ahead.
Oh, I was just going to say, I know she did have some concern about the breast because she has a history in her family of breast cancer. So she was concerned.
Okay. Well, looking at that, the regulation capacity is good. Still seeing a lot of toxicity in the whole body, including the breast. The breast suspicion criteria are perfect, 2 out of 12. You see the chest disorder, this has to do with, the autonomic nervous system, if there's good regulation or if it's chaotic and out of range. So overall, that's really good. And then again, these here, the mastopathy, inflammatory, fibrocystic, they're all optimal, so they're both optimal, so that's great. There is an extreme breast side difference, and the breast side difference is the average temperature of all the points, so it's not just the nipple point.
Okay.
Yeah, so it's all the points averaged, and then that breast is warmer. So we'll take a look at the graph, and you'll be able to see, is this looking, is this warmer because it's actually warmer than the normal range of temperature, or is the right breast so cold that because of toxicity, because she has systemic toxicity. So we'll get a little bit more information when we look at the graph.
Okay.
And so for here, we're just not going to want to forget about underlying focal infection. But it's just a good thermogram. Breast analysis. So, okay, here it's easy to pick out the toxicity and adrenal stress, TMJ, a little bit with, cranial dysfunction and carotid questions. So probably still continue with some, osteopathic or cranial sacral, and that type of work will always be good for her.
Okay.
And there you have the thyroid and the head emphasis. The airborne allergies are going to reflect the lungs, but it's also a hyper sensitivity, hyper behavior that triggers those signatures. And you can see that the lower pelvic and kidneys in the back. How does she have, oftentimes if you have a severe TMJ, the osteopath will also work on the pelvic area, so there can be, the problem can originate in the pelvis area. And if she was in that terrible accident, was it a car accident that involved her whole body, do you think?
I don't know for sure.
Okay.
I did it because we were trying to keep her calm, and I was afraid if she talked about it too much, it would, she would.
Yeah, good point.
So I didn't let her talk about it a lot because I was afraid, to revisit
Yeah,
that.
I think that's a really good idea. Just save it for after the test is done. Even if I see scarring on the patient's body that I didn't know was there, I won't mention it until after the test is complete.
Okay.
Just so I don't upset them.
After I really forgot about asking her about it. I didn't think about it in regards to this. I will in the future.
Good. Yeah. All right. And so here, there's a couple of things we want to point out. Since you're a little bit new to the graph, I'll just kind of lead you here.
Okay.
This glabella point here, see the difference is 1, 2, and almost 3 degrees difference.
Yes.
So that would be like, uh-oh, is this going to be a good thermogram? And that's a big difference. That would be a really good question for Dr. Bielman. And then the glabella point here is within range. It's within 1 degree. You can't see the first one because it's the same temperature as the baseline, but the second one is, the second one is less than 1 degree cooler. So there's the only one that's concerned is this glabella point in the head. But because of her head history too, it would kind of make sense that the head area might have a little difficulty regulating.
That was the first reading, the black one that's so
yes.
high up to 30? Okay,
yeah.
Could it have been just we didn't get the point right since this was our first actual patient?
It's possible. You have other warm readings here in the lymph, though, and even this head point, this commissure point here is fairly warm. And also, see this cubital fossa point way over here, this cubital fossa 4? Oops.
Yes.
So this is really out of the range. It's hyper-regulating normally, but because the temperatures are so out of the range, that's why the disorder index came up high. It said the disorder remained high or increased. The disorder increased.
Right.
Oh, it remained high because here's DIA, the disorder index for the first set of temperatures up here in this table, and DIB is the disorder for the second. And so you can see where it's high, 10 and 9. And that's because these temperatures are so out of range with the yellow. This one's really warm and this one's cold. So, but it is hyper-regulating. It's not like it's increased in temperature or blocked, which would be much more concerned.
Because I saw, chest, lower abdomen, all of those are so low.
Yeah, and you can see, oops, this hyper 100% hyper regulation here. So yeah, these are really hyper cooling. So and she might have been nervous because when you're a staff person getting unless she's very free spirit, she might have been a little nervous too.
Sure.
But you do see these type of thermograms once in a while where everything is really hyper. So you want to, check her emotional stress level as well as thinking of what could be triggering that.
Her emotional
toxicity.
Stress very high.
Mm-hmm. And then here, I wanted to point out these breast things. So you can barely see the yellow shading in the back. I don't think I can blow it up to be dramatic here. Okay, and you can see where this right breast, overall the temperatures are really way colder than the normal range. And it's this point here that you finally did get. Wasn't it the right breast nipple?
Yes.
That would be E on the right breast. See how the temperature is just out of range here. It's below 28. So it's off the chart. And that's, I think, why you had the difficulty. So there's nothing wrong with your probe or the way you were touching. I think that the temperatures are just so cold. And then the left breast is closer to the normal range and has normal and hyperregulation. So even though the signature, even though up here you can go, this 11 is the right breast and 12 is the left here. So you're looking at the side differences, and the right one was 29.1 and the left one was 30.1. So in average, the left breast was 1 degree warmer than the right. But that's pretty cold temperatures.
Yeah, but is that a significant difference?
It is a significant difference, but like in the thermogram that we did previously of the young girl, or was it Dr. Widman's, where you could really see that one breast had the temperatures were really a lot closer to the baseline. And that is where you would be more suspicious. See, this is an example of hypertoxicity and very cold temperatures throughout the body, the lower abdomen, chest, and upper abdomen. And so this right breast, these are really unusually cold temperatures, which sometimes you see if women have very large breasts. And so I wouldn't say that there was something wrong with this left breast because it's warmer. I think it's warmer, they're both normal, and that it's just the right breast is a lot colder. And sometimes you see that if one breast is smaller than the other too. So
I know they weren't large, but I don't know I don't know if they're asymmetrical or anything.
you usually can tell, or they'll tell you, or you'll see them. When they get dressed, if you're in the room when they get dressed, they'll put a pad in one. Sometimes it's just an anomaly that the one breast is smaller than the other. It's just just the way they grew. So that's kind of a good example where I wouldn't be alarmed about those breasts being warmer just because the other one is so cold.
Okay. Do you think it would be a good idea to do a retest on her, because she could have been more anxious because she was our first person and she
absolutely. It would be a good idea to do a retest on her.
Would do a second one on her.
Yeah.
Maybe a couple weeks later, if I wanted to see how it came out, but I thought that might be a good idea.
Yeah, I think that would be a good idea. And she might have the same overall signature pattern of really this hyper-regulation and the toxicity element, but it just might not be as severe as cold temperatures. The difference here is 1, 2, 3, 1, 2, 3, 4 degrees in the pancreas. So you could see a big difference from L5 and 6, which is at 37 degrees approximately, down to the coldest point here in the lower abdomen, which is 29. So that difference between 29 and 37 is 8 degrees. So that's a big difference. We don't like to see those big differences in temperatures between the regions of the body. So,
what does that mean?
Well, it's just a lack of regulation capacity. The body has a hard time, staying within its normal limits, and it shows a weakness and a vulnerability. It's someone who, instead of taking a direct line walking from their car to the store, takes a zigzag line and is all confused about how to get to the store. So it's a lot of exaggerated behavior here, exaggerated temperatures, exaggerated cooling, paradox behavior as well. And so that's why it's interesting if you look in where the disorder index is here in these, you can see in the head it stays high, the neck it decreases, but it started off really high. And the cubital fossa is also, has to do with regulation capacity, disturbance fields, peripheral circulation. So those are the most severe. But she did have trauma, to the head area. So it will be interesting, I think, and fair to her and you to go ahead and do a retest. You can see also the disorder is high in these breast areas. It stayed high, really out of range. And this lower
What's
left
considered
jaw.
the normal for the disorder?
Well, 0 is perfect,
Right.
So that means that all the points are within the yellow shaded area, and there's not not a huge diversity of point behavior like hyper, normal, hypo, rigid, all within one area. So having all different kinds of regulation, like in this area, too, is the neck. And this is the last thing. We'll just finish up with this. Here's the neck area. So we have normal regulation, hyper-regulation, and paradox regulation, all within one area of the body. And then in addition to that, we also have extremely warm temperatures way out of the range, and we have cold temperatures that are about a degree out of the range. So that's why the first temperature readings were really out of range. You know, the disorder was high, and then in the second one, we did see some normal regulation. So at least it came down, but it's still high from 10 to basically 8. But that's an example of how there's different temperature behaviors, which are these different colorings up here, and then the temperatures being way out of the normal yellow range. And that drives the disorder index up.